When we administer anesthesia, we pay a great deal of attention to the concentration of nitrous oxide and halogenated agents such as sevoflurane or desflurane that our patient receives. We know that too much or too little of these gases can harm our patients. We are often less compulsive about avoiding exposure to ourselves or even our operating room colleagues to waste anesthesia gases. The anesthetic gases and vapors that leak into the surrounding room from the patient's anesthetic breathing circuit during medical procedures are considered waste anesthesia gases. These gases are so potent that trace gas exposure is typically measured in parts per million. 1% of an anesthetic gas equals 10,000 parts per million. Our goal is to minimize exposure to these waste anesthetic gases to less than 2 parts per million of the halogenated agents and less than 25 parts per million of nitrous oxide. Do not rely on your sense of smell to protect you. Anesthetic gases cannot be detected by smell until concentrations are very high. For example, halothane cannot be smelled by 50% of the general population until the concentration is 125 times the NIOSH recommended exposure limit of 2 parts per million. Why should we worry about waste anesthetic gas exposure to ourselves and our perioperative staff? First of all, there are health effects. Exposure to high concentrations of waste anesthetic gases, even for a short time, may cause difficulties in judgment, loss of coordination, impaired manual dexterity, drowsiness, headache, irritability, fatigue, and nausea. There is evidence that long-term exposure can reduce fertility and cause neurological, renal, and hepatic disease. In addition, anesthetic gases are potent greenhouse gases. Almost all anesthetic gases introduced into the circuit or exhaled by patients end up in the atmosphere where they contribute to global warming. Nitrous oxide can also deplete the ozone layer. There are a few things that we can do to minimize exposure, such as maintaining a good mask seal, maintaining the scavenger system, and refilling the vaporizer container appropriately. Exposure to waste anesthetic gases occurs more commonly whenever we provide anesthesia for surgery around the airway and caring for patients when obtaining a mask seal is difficult. Good examples include pediatric mask inductions, patients with beards, and tonsillectomies. Ensure the scavenging system on the anesthesia machine is working. The scavenging system evacuates anesthetic waste gases from our anesthesia machine through a vacuum source and expels it into the atmosphere. To function properly, the vacuum must be properly adjusted. Make sure all the connections are tight. The circuit must be as closed as possible, including having a proper mask fit. Failure to properly use the scavenging system can easily produce exposures of 18 parts per million of halogenated agent and 300 parts per million of nitrous oxide. When possible, fill the vaporizer before the patient and the operating room crew are in the room. If it's necessary to refill the vaporizer during a case, make sure that proper adapters are used and avoid spills. In addition to reducing occupational exposure to waste anesthesia gases, you can also minimize the contribution of these waste gases to global warming. No matter which anesthetic agent you choose, strict attention to lowering fresh gas flows is the primary method to reduce your contribution to climate change. Because desflurane and nitrous oxide have the highest climate impact, their use should be restricted to cases where they may reduce morbidity and mortality over alternative drugs. Let's look at some common practices that increase our risk of exposure. How many opportunities can you spot to decrease your exposure to waste anesthesia gases?
I'm going to give you some oxygen to breathe, and I'm going to have you take some nice big deep breaths for me, okay? So here you are. right. Go ahead and take some nice big deep breaths for me. Nice breaths. That's good. You're doing a great job. Good. Okay, Rowan, take some nice big deep breaths for me. Big deep breaths. That's great.
Whew! Gosh, can you smell that gas? Whew, I can smell that one.
Oh my gosh, I'm falling asleep. Can't you do anything about this anesthesia gas?
That uncuffed tube was a little bit too small, but I didn't want to replace it. Could you please pack the throat?
Okay, can you get me some packing, please?
Surgery's all done. You did really well. I'm gonna take this mask off of you and put another mask on, okay? All right. Good job. All right, take some nice big deep breaths for me. Good.
If you want, now would be a good time to pause this video and talk about any opportunities you saw to decrease exposure to waste anesthetic gases. Let's look at that sequence again and see how we could have avoided exposing ourselves and our teammates to waste anesthetic gases. The anesthesia provider was incautious when filling the vaporizer. 1 milliliter of spilled sevoflurane or desflurane can produce close to 200 milliliters of halogenated gas, a significant contamination. Maintaining a good mask seal is important. We commonly do mask inductions in small children to avoid the emotional trauma of IV insertion while the child is awake. Preloading the circuit with anesthesia can be helpful, but in this case, the high-flow anesthetic gas flowed freely into the room where everyone could breathe it. After the child starts to fall asleep, the provider applied the mask loosely, allowing the anesthetic to deepen gently without stimulation. The vaporizer should be turned off or flows should be decreased when the circuit is disconnected. If too small an uncuffed endotracheal tube is chosen, gas leaks around the tube and can make your surgeon and their assistants sleepy. At the end of the case, to expedite wake-up, this provider dumped gas out of the bag and flushed the circuit into the room air, totally defeating the scavenger system. The room is contaminated whenever the anesthesia provider disconnects the breathing circuit without closing the circuit, turning off the vaporizer, or decreasing gas flow. After extubation, the anesthesia provider switched to a simple mask, allowing the patient to exhale gas into the room rather than allow the patient to breathe gas back into the scavenging system for a few minutes. The entire team will breathe excessive amounts of waste anesthesia gas if you bypass the scavenging system. If you don't remove waste anesthesia gas through the scavenging system, then emptying the circuit and bag will expose your anesthesia technicians to waste anesthesia gases. Let's review ways to reduce exposure to waste anesthesia gases. Ensure your scavenging system is working and machine connections are tight. Make sure the filler cap is tight when filling the vaporizer. Stop filling before the line and then wait a few seconds before removing the filler cap and agent bottle from the cassette. Avoid spilling liquid anesthetic. Clean any spills promptly and properly. When doing mask induction in small children, it's important to avoid frightening them and to enlist their help. Close the breathing circuit before you pre-fill it. Play the blow up the balloon game, which requires a good mask seal to work. Telling stories or singing a song will often make a child cooperative and unlikely to fight the mask. Have the child lie down when possible. If the child does struggle, hold the mask firmly but gently to speed induction. Wait until the mask is applied to the face before turning on the vaporizer for either a child or an adult. With any anesthetic, minimize disconnections to the circuit while the anesthetic is flowing. Turn off the vaporizer, decrease flows, or plug the circuit. For maintenance, use the lowest flows appropriate. The minimal recommended flow may vary depending upon the agent used. Decreasing the total amount of anesthetic vaporized not only helps protect you and your staff, it decreases global warming. Towards the end of the case, use high-flow oxygen to wash anesthetic into the scavenging system. If you disconnect to flush the circuit, close the end of the hose to prevent gas escape. Flush the bag into the circuit, not the room. Once the endotracheal tube or LMA is removed, replace the anesthesia mask on the patient's face for several minutes, both to verify optimal ventilation, as well as to allow the scavenging system to remove the majority of the remaining exhaled anesthetic. With a little attention to detail, you can minimize exposure to waste anesthesia gases to you and your colleagues. Always protect yourself and your team.